Hello and welcome back to Mirror Interpretation Tutorova. Welcome back to my YouTube channel. My name is Ioana and I'm an interpreter with Hungarian, Italian, Russian, Macedonian, English and some Ukrainian. Um, I'm so happy to have you here, guys. If you're new to my YouTube channel, this is channel about languages, linguistic and language providers. And you can see I just launched my join button. The first button is $3.99 a month, where you can ask questions, which I will address directly once a month in my lives. You can also see videos once a week that are not published. They are just for this member level. And then if you get a subscriber member level number 2, which is $7.99 a month, you're gonna see approximately 10 or 15 videos that every week I update about what I do in my daily life as an interpreter, as a language provider, how I interview the companies and how I choose for whom to offer my services. And today I'm happy to create another bilingual medical terminology video, Spanish versus English, with my colleague, Jose. Go ahead, Jose.
Hello, thank you very much, Ioana. This is Jose Alvarez again. I'm from Costa Rica and I'm dedicated medical interpreter for more than 10 years of experience and several languages, French, English, Portuguese, Spanish, and Hebrew. And I work for language analysis and linguistic analysis companies as well. And my dedicated video setting this time is for medical interpretation setting for testing. So I'm happy to work with Joanna right now, and we're going to proceed to have the continuation of medical interpretation testing. Hola, mi nombre es José Álvarez, soy un lingüista y trabajo con lo que es las compañías de proveedores de servicio de idioma, traducción e interpretación a nivel de escolta y a nivel de interpretación médica y de salud con más de 10 años de experiencia en diferentes idiomas. Y vamos a trabajar lo que es la tarde y el día de hoy con respecto a la terminología médica para lo que es la estandarización de exámenes.
Gracias. The first term is hole in the heart. Hole in the heart.
The register for this common word will be hueco en el corazón, hueco en el corazón, or you have a different register, most commonly from Puerto Rico and Caribbean, hoyo en el corazón, hoyo en el corazón.
Have you had any surgery? Have you had any surgery?
¿Ha tenido alguna cirugía? ¿Ha tenido alguna cirugía?
Amputation, amputation.
Amputación, amputación.
Aneurysm repair, aneurysm repair.
Reparación de aneurisma, reparación de aneurisma.
A prostate repair, prostate repair.
Reparación de la próstata, reparación de la próstata.
A bladder repair, bladder repair.
Reparación de la vesícula, reparación de la vesícula.
Aortic stent or just stent, aortic stent.
Malla aórtica o malla coronaria. Malla aórtica o malla coronaria.
Do you know what is a mesh? I'm sorry, it's not included. The mesh that they repair the appendix.
Mesh in that particular case will be malla o gasa reparadora. Malla o gasa reparadora.
Thank you. A heart stent, a heart stent.
The particular word stent will be translated as such, stent cardíaco. Stent cardíaco.
Bypass, bypass.
In this particular case, bypass is the same exact term, bypass. bypass,
Laparoscopic procedure. Laparoscopic procedure.
procedimiento laparoscópico, procedimiento laparoscópico,
Pacemaker. Pacemaker.
marcapaso, marcapaso,
Lower extremity bypass. Lower extremity bypass.
bypass de las piernas, bypass de las piernas,
Orthopedic surgery. Orthopedic surgery.
cirugía ortopédica, cirugía ortopédica,
Neck, shoulder, calf, hip replacement. Neck, shoulders, calf, or hip replacement.
reemplazo del cuello, hombro, pantorrilla o cadera, reemplazo del cuello, hombro, pantorrilla o cadera.
Then there is this do you questions. Do you do something?
¿Hace usted algo o consume usted algo?
Do you drink alcohol? Do you drink alcohol?
¿Bebe usted alcohol o consume usted alcohol?
Recreational drugs, which means marijuana here. Recreational drugs.
Drogas recreativas. Drogas recreativas.
Uso de use tobacco.
Consume tabaco. Consume tabaco.
How many cigarettes or packs a day do you smoke?
¿Cuántos paquetes diarios fuma usted de cigarrillos? ¿Cuántos paquetes diarios fuma usted de cigarrillos?
Other illegal drugs. Other
O-
illegal drugs.
Otras drogas ilegales. Otras drogas ilegales.
Do you have iodine allergy? Iodine allergy.
¿Es usted alérgico al yodo? ¿Es usted alérgico al yodo?
Latex allergy. Latex allergy.
¿Es usted alérgico al látex? ¿Es usted alérgico al látex?
Do you have any medicine intolerance or reactions? Do you have any medicine intolerance or reactions to medicines?
¿Padece usted de alguna reacción o intolerancia a algún medicamento? ¿Padece usted alguna reacción o intolerancia a algún medicamento?
Do you have a shrimp allergy? Do you have a shrimp allergy?
¿Es usted alérgico al camarón? ¿Es usted alérgico al camarón?
Do you have a yolk allergy? Yolk allergy.
¿Es usted alérgico a la yema de huevo? ¿Es usted alérgico a la yema de huevo?
The next part of this video, it's called a mental health questionnaire. Mental health questionnaire.
Cuestionario sobre salud mental. Cuestionario sobre salud mental.
Have you had a little pleasure or interest in doing things? Have you had a little pleasure or interest in doing things?
¿Ha tenido usted poco placer o interés en hacer cosas? ¿Ha tenido usted poco placer o interés en hacer cosas?
Have you felt down, depressed, or hopeless? Have you feel down, depressed, or hopeless? And normally the doctor asks this in the last 2 weeks. All these questions in the last 2 weeks. Have you feel down, depressed, or hopeless?
¿Se ha sentido usted decaído, deprimido o sin esperanza? ¿Se ha sentido usted decaído, deprimido o sin esperanza?
And then normally they give you answers from which the patient have to pick. So we're gonna give them all together. Several times, more than half of the time, nearly every day. Several times, more than half of the time, nearly every day.
Algunas veces, más de la mitad del tiempo o casi cada día. Algunas veces, más de la mitad del tiempo o casi cada día.
Do you have trouble falling asleep or sleeping too much? Do you have a trouble falling asleep or sleeping too much?
¿Tiene usted problema a la hora de dormir o dormir demasiado? ¿Tiene usted problema a la hora de dormir o dormir demasiado?
Do you feel tired or have little energy? Feeling tired or have a little energy?
¿Se ha sentido cansado o ha tenido poca energía? ¿Se ha sentido cansado o ha tenido poca energía?
Do you have poor appetite or are you overeating? Poor appetite or overeating?
¿Ha tenido pobre apetito o ha sobrecomido demasiado? ¿Ha tenido pobre apetito o ha sobrecomido demasiado?
Do you feel bad about yourself or think that you are a failure or have let yourself or your family down? Do you feel bad about yourself or think that you're a failure or have let yourself or your family down?
¿Se ha sentido usted mal sobre usted mismo o piensa que usted es un fracaso o ha pensado usted que su familia no lo quiere? ¿Se ha sentido mal sobre usted mismo o ha pensado que usted es un fracaso o ha pensado que su familia no lo cree?
I want to ask you a question here. So, because let your family down, it could be disappoint your family, or could be like your family doesn't love you, or like you didn't met their expectations. Can you give this like disappoint and didn't met their expectations?
In
Can
this particular case, disappoint would be desilusionar a su familia or not meet family expectations, no estar a la expectativa de su familia. I repeat, desilusionar a su familia or no estar a la expectativa de su familia.
which also can be the three correct interpretation, because let your family down could mean one of these three things or all of them together, which you pick the best one you feel. Have you have trouble concentrating on things such as reading or watching TV?
¿Ha tenido usted problemas a la hora de concentrarse en cosas como leer o ver la televisión? ¿Ha tenido usted problema en concentrarse en cosas como leer o ver la televisión?
Do you speak slowly in a way that other people have noticed or move unusual ways?
¿Ha usted hablado lentamente para que otra gente lo note o se ha movido usted de una manera inusual? ¿Ha hablado usted lentamente para que otra gente lo note o se ha movido de una manera inusual?
I want to give you a clarification for this question, because this question is asked in out settings out of mental health. This question is related to stroke or anything, infarct, insult related to a heart attack or a brain attack, one of these two. And normally when people have stroke, they don't understand that, but when you interpret, you could hear that they speak slowly, and you can also hear that their speech is impaired. So normally, if I work for the emergency room, the doctors sometimes doesn't ask this question, but use an interpreter. If you hear the patient to speak like a little children, like a little child, not that is a, or speak in a way that doesn't conjugate or connect together the phrases and speak words like a little person or a younger person, I normally inform the provider. I say, this is the interpreter speaking. The person doesn't properly connect or make the phrases. So this could be a very serious physical condition. Can you say this in Spanish or some part of it, please?
Of course, the interpretation rendering in Spanish for this setting will be el o la paciente no conecta las palabras apropiadamente. El o la paciente no conecta las palabras apropiadamente. In this particular case, the interpreter has warned the provider that the patient is not connecting sentences. So the Spanish term for this scenario would be conectar frases o conectar palabras. Again, the whole rendering would be el paciente or la paciente no puede conectar frases. El paciente o la paciente no puede conectar frases o palabras.
Thank you. Have you told that you will be better off dead or thinking hurting yourself? The doctor doesn't like to use the word suicidal, but sometimes when I interpret this phrase, you gotta use the word suicidal, otherwise they don't understand what do you mean hurting myself. And they start asking a question. So normally after I said, have you told that you will be better off dead or thinking hurting yourself, I put, instead of hurting yourself, you can use the word suicidal, which is synonymous. Go ahead.
¿Ha pensado usted que estaría usted mejor muerto o muerta o pensar en matarse a usted mismo? ¿Ha pensado usted que estaría mejor muerto, muerta o pensar en matarse a usted mismo? This is the interpreter in the specific phrase. When the interpreter says this is the interpreter and then translates this rendering, there's a catch here, a linguistic catch. The word hurting in Spanish could be matarse, which means to kill oneself, or dañarse, which is a more euphemistic term that is used on some medical settings. So for the provider, in order to avoid the suicidal term, they use dañarse a sí mismo, which means hurting oneself, like self-aggression in this context.
Thank you. Do you have difficulty dealing with problems like taking care of things, get along with people? So do you have difficulties dealing with problems, taking care of things, or get along with people?
¿Ha tenido dificultades lidiando con problemas, cuidar de las cosas o lidiar con la gente? ¿Ha tenido dificultades en lidiar con problemas, cuidar de las cosas o lidiar con la gente?
Anxiety, anxiety,
Ansiedad, ansiedad,
confusion, confusion,
confusión, confusión,
memory lost, a memory loss.
Pérdida de memoria. Pérdida de memoria.
Reduced libido, reduced libido.
For this particular term, the high register would be libido, but the low and most common register is deseo sexual. So the whole rendering would be deseo sexual reducido. Deseo sexual reducido.
Fainting, fainting.
Desmayo. Desmayo.
Sleeping problems, sleeping problems.
Problemas del sueño. Problemas del sueño.
Seizures, seizures.
Ataques. Convulsiones. Ataques. Convulsiones.
And that was our last term for this video. Thank you guys for being here. Thank you for liking, sharing, and subscribing. I appreciate your presence. Thank you, Jose. It's a pleasure to work with you. Do you like to say something?
Thank you very much again, Joanna, for this opportunity. And thank you for all the people that are actually watching or hearing from us and that take this advantage for using all this terminology for standard testing.
And I also like to let you know that I would leave the information of Jose below. So if you do need English Spanish interpreter, feel free to contact him. Thank you guys for being here and have a good day. Bye-bye.